A memory problem does not always begin with age. Sometimes it begins with a medication list that has not been reviewed in years. A person can be sharp, independent, and mentally active for most of life, then suddenly start misplacing familiar words, forgetting appointments, losing track of conversations, or feeling strangely disconnected from everyday routines. Families often assume the explanation is simple. This is what getting older looks like. But that assumption can be dangerous. In some older adults, confusion and memory changes may be connected to a medicine, a combination of medicines, or a dose that the body no longer handles the way it once did. A drug that caused no obvious problem at age 45 may affect the brain very differently at age 70 or 80. I'm Dr. William, and in this video, we are examining 8 medication categories that deserve a careful conversation with a doctor when new memory problems, unusual sleepiness, confusion, or attention changes appear. This is not a list telling you to throw away your prescriptions. Several of these medicines can be necessary, protective, and even life-saving. The purpose is to help you recognize possible warning signs and ask better questions. Never stop, reduce, replace, or combine a medication without guidance from the clinician who knows your health history. Stay with me until number 1 because it includes powerful drugs that some seniors may be receiving for reasons they do not fully understand. And as you listen, think about your own medicine cabinet. How many prescription drugs, over-the-counter pills, nighttime products, and supplements do you use in a normal week? Let's begin. Medication number 8, diphenhydramine and PM products. The first warning is hiding in plain sight. Diphenhydramine, commonly sold under the brand name Benadryl, is found in many homes. People use it for allergies, cold symptoms, itching, and sometimes sleep. It is inexpensive, familiar, and available without a prescription, which makes it feel harmless. But available over the counter does not mean risk-free for every age. Diphenhydramine has anticholinergic effects. In simple language, it interferes with acetylcholine, a chemical messenger involved in attention, alertness, learning, and the formation of new memories. Older brains can be more sensitive to this effect, especially when the medicine is taken repeatedly or combined with other drugs that act on the same system. The change may not look dramatic at first. A person may wake up feeling heavy and unfocused. They may take longer to remember a name, lose the thread of a sentence, or feel mentally slower the next morning. Because the pill was taken for sleep or allergies, nobody connects it to the fog. The risk is easy to miss because diphenhydramine is not always printed in large letters on the front of the package. It can appear inside products labeled PM, nighttime, night relief, or allergy sleep aid. 2 products with different brand names may contain the same active ingredient. Here is the practical step. Read the active ingredient section, not only the product name. Bring every nighttime and allergy product to your next medical or pharmacy review. If you need long-term allergy treatment or help with sleep, ask whether a less sedating option would be more suitable for your age and medical conditions. Do not assume the little pill beside the bed is too ordinary to matter. Sometimes the most overlooked medicines create the most overlooked symptoms. Medication number 7, proton pump inhibitors. Number 7 is often taken for a burning stomach, but may remain on the medication list far longer than originally planned. Proton pump inhibitors, usually called PPIs, include drugs such as omeprazole and esomeprazole, commonly known by brand names including Prilosec and Nexium. They reduce stomach acid and can provide major relief for reflux, ulcers, and persistent heartburn. For the right person and the right reason, they can be extremely useful. The concern begins when a temporary treatment quietly becomes a permanent habit without follow-up. Stomach acid is not only a source of discomfort, it also helps the body absorb certain nutrients. With prolonged acid suppression, some people can develop problems involving vitamin B12, magnesium, or other nutrients important for healthy nerve and brain function. Deficiencies can sometimes appear as fatigue, tingling, weakness, poor concentration, or memory trouble. That does not mean every person taking a PPI will develop cognitive problems. It means long-term use deserves periodic review, especially when the original reason for taking it has changed or disappeared. Another problem is rebound. A person stops the medicine suddenly, the burning returns strongly, and they conclude they can never live without the drug. In reality, the return of symptoms may need a structured plan, lifestyle changes, evaluation of food triggers, meal timing, weight, alcohol or tobacco use, and sometimes a gradual adjustment under medical guidance. Ask your clinician 3 questions. Why am I still taking this? Is this still the lowest effective dose? Do I need blood tests or a different long-term plan? Never replace a prescribed reflux treatment with a supplement or herbal product without checking for interactions. Natural products can also cause side effects and may not be appropriate for kidney disease, heart disease, high blood pressure, or other conditions. The goal is not to fear stomach medicine. The goal is to make sure a medicine that began for a clear reason is still serving a clear purpose. Medication number 6, oxybutynin and some bladder medicines. Number 6 is prescribed for a deeply personal problem that many older adults are embarrassed to discuss. Overactive bladder can control an entire day. A person may avoid long car rides, family gatherings, shopping trips, exercise, or even a walk around the neighborhood because they are afraid they will not reach a bathroom in time. Oxybutynin, sold under names including ditropan, can reduce bladder urgency. The relief can restore confidence and independence. But oxybutynin also has strong anticholinergic activity, meaning it can interfere with the same acetylcholine system involved in memory and attention. In an older adult, especially one already taking other anticholinergic medicines, the total burden can become significant. The person may feel unusually sleepy, mentally slowed, disoriented, or forgetful. They may lose keys repeatedly, miss appointments, or struggle to follow a conversation. Everyone sees the change, yet nobody looks at the bladder prescription. This is why medication review must consider the complete list, not one drug at a time. A sleep aid, an allergy pill, a bladder medicine, and an older antidepressant may each contribute a small anticholinergic effect. Together, they can create a much larger problem. If memory symptoms began after oxybutynin was started or increased, tell the prescriber clearly. Do not simply say, "I have been a little forgetful." Explain when the changes began, how often they happen, and how they affect daily life. There may be other strategies or medications that work through different pathways, but the best choice depends on blood pressure, kidney function, urinary retention risk, glaucoma, other prescriptions, and the exact bladder diagnosis. That decision belongs in a medical consultation. You should not be forced to choose between dignity and mental clarity. The first step is making sure your doctor knows both problems exist. Medication number 5, statins. Number 5 requires balance because fear-based advice can cause real harm. Statins, including medicines such as simvastatin and atorvastatin, are widely prescribed to lower cholesterol and reduce the risk of heart attack and stroke. For many people, especially those with cardiovascular disease or a high risk of it, these drugs provide an important protective benefit. This is not a reason to stop a statin. However, some patients report new mental fog, unusual forgetfulness, or difficulty concentrating after beginning treatment or changing to a higher dose. The relationship between statins and cognition is complex, and not every memory complaint is caused by the drug. Poor sleep, depression, thyroid disease, vitamin deficiencies, uncontrolled diabetes, infections, and many other conditions can create similar symptoms. That is why the timing matters. Did the problem begin soon after the medication was started? Did it appear after the dose changed? Did another medicine enter the list at the same time? Are the symptoms constant, or do they come and go? Those details help a clinician decide whether the statin is relevant or whether another cause needs attention. Different statins behave differently in the body, and the correct response may involve checking other causes, reviewing the dose, changing the time it is taken, or considering another option. But that choice must protect both the brain and the heart. The most dangerous move is quietly stopping a medicine that may be preventing a stroke. A stroke itself can permanently damage memory, speech, movement, and independence. So the message is simple. Report cognitive changes, but do not make the decision alone. A good medication plan should reduce cardiovascular risk without dismissing symptoms that matter to your quality of life. Before we continue, check the comments and tell me how many medicines you take in a normal day. Include over-the-counter products because those are often forgotten during medical appointments. And if this information is helping you look at your medication list differently, share the video with someone who manages prescriptions for a parent or grandparent. Medication number 4, benzodiazepines. Number 4 can feel like a rescue at the exact moment someone is most desperate. Benzodiazepines include lorazepam, sold as Ativan, diazepam, sold as Valium, and alprazolam, sold as Xanax. They may be prescribed for severe anxiety, panic, muscle spasms, certain medical procedures, or short-term sleep problems. They work by strengthening the brain's calming signals. Panic settles, muscles relax, racing thoughts slow down, sleep may finally arrive. But repeated use can also produce sedation, slower reaction time, poor coordination, weaker attention, and difficulty forming new memories. In older adults, these effects may last longer because the body often clears medicines more slowly. A dose taken at night can still affect balance and thinking the next morning. The result may be blamed on age, a fall in the hallway, confusion after waking, a forgotten conversation, or a sense of emotional flatness. The person may feel as though they are watching life through a layer of fog. There is another serious issue: dependence. After regular use, the nervous system adapts. If the medicine is stopped suddenly, anxiety and insomnia can return intensely. In some cases, abrupt withdrawal can cause severe and dangerous reactions. That is why benzodiazepines should never be stopped suddenly after ongoing use unless a qualified clinician gives specific instructions. A safe taper may take weeks or longer depending on the medicine, dose, duration, and individual health history. Treatment alternatives may include non-sedating medications, cognitive behavioral therapy for anxiety, cognitive behavioral therapy for insomnia, relaxation training, sleep schedule changes, and treatment of underlying pain, breathing problems, depression, or nighttime urination. The question is not, is this drug good or bad? The better question is this still the safest tool for the problem I have today? Medication number 3, amitriptyline. Number 3 is an older medicine that is still used for several different reasons. Amitriptyline, commonly known by the brand name Elavil, was developed as an antidepressant. Today, it may also be prescribed in smaller doses for nerve pain, migraine prevention, and sleep difficulties. Because one tablet can appear to address several complaints, it may stay on the list for years. But amitriptyline has strong anticholinergic effects. In an older person, that can contribute to dry mouth, constipation, blurred vision, urinary problems, sleepiness, confusion, and memory difficulty. The cognitive change can be gradual. A person may not wake up one morning feeling completely different. Instead, words become harder to retrieve. Reading requires more effort. Concentration breaks more easily. A familiar task needs extra steps. Because the decline is slow, the medication is rarely suspected. Even a low dose can matter when it is taken regularly and combined with other medicines that affect the same brain pathways. If amitriptyline is being used for pain, sleep, migraine, or mood, ask the prescriber to explain the current benefit and the possible age-related risks. There may be alternatives, but they are not automatically safer for everyone. Some can cause dizziness, falls, low sodium, bleeding risks, weight changes, or other problems. A proper review should include the reason for treatment, the length of use, kidney and liver function, fall history, sleep quality, mood symptoms, and every other medicine being taken. The key phrase to use at the appointment is this: could the total anticholinergic burden of my medications be affecting my thinking? That one question can change the entire conversation. Medication number 2, paroxetine. Number 2 is a modern antidepressant with an older style concern. Paroxetine, sold under the brand name Paxil, belongs to the SSRI family and may be prescribed for depression, anxiety, panic disorder, and other conditions. SSRIs are often viewed as a gentler category than older antidepressants, but individual drugs within the same family are not identical. Paroxetine has meaningful anticholinergic activity compared with several other SSRIs. That matters in older adults who already have memory complaints, balance problems, constipation, urinary difficulty, or a long medication list. The warning signs may include worsening attention, short-term memory trouble, daytime sleepiness, or a feeling that mental processing has slowed. But depression and anxiety themselves can also interfere with memory, so the situation is not as simple as blaming the treatment. Stopping paroxetine suddenly can cause uncomfortable withdrawal symptoms. A person may experience dizziness, irritability, sleep disruption, anxiety, or unusual physical sensations. For that reason, any change should be planned and gradual under medical supervision. If paroxetine is working well, the prescriber may decide that continuing it is appropriate. If cognitive side effects are suspected, the clinician may review the dose, other medications, treatment goals, and possible alternatives. The important point is not that every older adult must avoid the same drug. It is that medication choice should reflect age, symptoms, side effect sensitivity, and the full medical picture. A prescription intended to protect emotional health should be reviewed if it appears to be reducing alertness, memory, or daily function. Medication number 1. Antipsychotic medications used without a clear explanation. Number 1 deserves the closest attention because some patients and families do not realize an antipsychotic has been added to the medication list. Examples include quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa. These are powerful medicines developed for serious psychiatric conditions, including schizophrenia and bipolar disorder. In selected situations, they can be essential, but they may also be prescribed off-label for severe agitation, behavioral symptoms of dementia, or persistent sleep problems. Sometimes the family hears only, "This will help them settle down," without receiving a full explanation of what the drug is, why it is being used, how long it is expected to continue, and which risks require monitoring. These medicines can cause substantial sedation and slower thinking. Depending on the drug and the individual, they may also affect movement, blood pressure, blood sugar, weight, balance, and alertness. In a frail senior, the difference between calmer and oversedated can be the difference between walking independently and falling, eating normally and sleeping through meals, or communicating clearly and appearing more confused. Behavioral symptoms in dementia can be extremely difficult and sometimes dangerous. Families and caregivers may be exhausted, and a medication may be considered when someone is at risk of harming themselves or another person. But the decision should be specific, documented, and reviewed regularly. Ask these direct questions. What exact symptom is this medicine treating? What benefit should we expect to see? What side effects should we watch for? Is the current dose the lowest effective dose? When will the need for this medication be reviewed again? Non-drug causes of agitation should also be considered. Pain, constipation, urinary infection, dehydration, hunger, fear, unfamiliar surroundings, hearing loss, medication interactions, and disrupted sleep can all change behavior. Treating the cause may sometimes reduce the need for sedation. Do not stop an antipsychotic on your own, but do not allow a powerful medicine to continue indefinitely simply because nobody scheduled the next review. The most important message. If you remember only one thing from this video, remember this. Memory loss should never be dismissed as just aging until reversible causes have been considered. A medication may be necessary and still need adjustment. A drug may have been appropriate 5 years ago and no longer be the best choice today. A dose may become too strong after weight loss, kidney changes, liver changes, illness, or the addition of another prescription. Make a complete list of everything you take. Include prescriptions, pain relievers, allergy pills, nighttime products, bladder medicines, stomach medicines, vitamins, supplements, drops, creams, and medicines used only occasionally. Next to each item, write why you take it, who prescribed it, when it was started, and whether you still notice a benefit. Then bring the list to a doctor or pharmacist and ask for a full medication review. Do not ask only, are these medicines safe? Ask more specific questions. Could any of these be affecting memory or attention? Do any of them have anticholinergic effects? Could 2 or more medicines be creating the same side effect? Are any of these no longer necessary? Is there a safer dose, schedule, or alternative for my age? And most importantly, never stop a prescription suddenly because of a video. Some medicines can cause dangerous withdrawal, a return of serious symptoms, or a higher risk of heart attack, stroke, seizures, or psychiatric crisis when discontinued incorrectly. Use this information to begin a conversation, not to make a diagnosis. Now tell me in the comments, which medication on this list surprised you most? And when was the last time a doctor or pharmacist reviewed every medicine you take together rather than looking at them one by one? Share this video with a family member who helps an older adult manage prescriptions. A 10-minute medication review can sometimes explain symptoms that have been blamed on age for months or even years. Protecting memory is not only about puzzles, food, or exercise. Sometimes it begins with asking a simple question about the pills already sitting in the cabinet. Educational note. This script is intended for general information and should be medically fact-checked before publication. It does not replace diagnosis or individualized advice from a licensed healthcare professional.